This is Jerry Hesch. This is towards the end of a Hesch Method seminar, and this is Troy, who has an interesting presentation. We just finished treating his left foot and ankle, and we're going to treat his right foot and ankle, and he's going to describe his injuries to us and his experience in that right foot and ankle, and he's going to tell us what happened to his left one in response to treatment.
1991, I had a tibia and fibula fracture playing soccer, contact injury. I was placed in a long leg cast for 2 months, then in a short cast for 1 month. After the 3-month time, it was found that I had a non-union fracture, so I was put in a tibial brace and actually started on a jogging and loading program for probably about a month or two. There was no change, so they did a fibular osteotomy, so I would totally load the tibia. After about 2 or 3 months, the bone healed. My last appointment with the physician, he said 70–80%. I then had a lot of ankle problems when I tried to return to sport. Numerous cortisone injections with loading, and that seemed to break up some scar tissue, so my pain went away. And I'm virtually, I don't have any pain. I guess there's some stiffness, intermittent, but I don't have any pain. I had an ACL tear in I'm thinking that was in 99 on the left and 2001 on the right, both non-contact injuries in sport. And I had both of those reconstructed using hamstring.
And a non-contact ACL tear is a pretty rare beast, isn't it?
I would think. I mean, I was just jumping over somebody.
Why do you suppose it tore on you? I mean, you're a pretty solid-looking guy.
I was thinking just weakness and deconditioning, but I had just finished rehabbing this one pretty intensely and returned to sport for the first time and tore this one.
My theory is I think because you had no ankle, no foot and ankle motion. Very restricted. Both of your feet and ankle were in supination. Very little pronation mobility, very little dorsiflexion. I think you lost your shock attenuation there.
Well, it's possible. I mean, I haven't really had any other musculoskeletal problems to date.
Yeah, yeah. So tell us about how the lower extremities are today.
I think I have some issues more with, it appears that there's some circulatory problems. I have a lot of what appears to be superficial capillary damage. I have large calluses that form, especially on the medial side of the great toe. I can actually take that callus down and it'll reform in a couple days.
Yeah, it's a pretty serious.
Yeah,
callus. Don't move your foot. I'm trying to find it. Yeah, so the discoloration is very apparent. Not just the callus, but the circulation of the foot and ankle.
All the way up.
As well.
So, and there's also, I mean, there's just edema of that whole leg still. If you really look at it.
And there's even discoloration in the other one.
Right.
As well. And we just finished working, both feet were identical in their lack of mobility. And I think we'll try and capture that from a side angle. Let me zoom out. Sorry, bear with me. So a while ago, I tested both feet and ankle. They were pretty much identical. The dorsiflexion was limited to neutral. There was really no varus, no valgus in the calcaneus. No abduction, and there was no midfoot pronation. This foot was not treated, this foot and ankle. And when I stabilize the tibia and I try and twist the calcaneus, there's just no abduction, no adduction. When I try and push it into valgus, there's so little motion. And even pushing into varus, there's a little bit more into varus. Okay, just remarkably restricted. And in dorsiflexion, With a lot of effort, he gets to neutral, but he sure doesn't like it. He really likes, he quickly goes back down. We worked on this foot and restored some motion, and he's got now about 5 degrees of dorsiflexion on that side. See that? Very strong. His muscle power is just fabulous, but very, very rigid. And now on this side, we did restore some of that midfoot motion. The cuboid was not moving at all, and that's now moving. Fibula had no mobility, and
that right there is amazing.
I can create a little bit of give there,
a
little bit of mobility up at the fibular head. So I just want to demonstrate that restriction, and his gait pattern improved a little bit. He had quite a whip off of that fifth metatarsal on the right, and he had a little bit of whip on the left. And the whip on the left reduced in response to what we did. Anything else you noted when you were walking?
Actually, it felt like I was actually pushing off to kind of propel myself forward, where I guess I never knew that I didn't do that before, but I could actually feel that I was actually pushing myself forward with my gait.
Very good. So let's mobilize the right foot and ankle, and then we'll get your feedback on that.
Okay.
So I'll stop filming right now.